My name's Graeme Moyle. I'm from the Chelsea and Westminster Hospital in London, the UK. In terms of big news for the year, I really think the START study has been a critical change to the way in which we're thinking about treatment. The START study randomised people with CD4 counts above 500 and good health status to either immediate initiation of antiretroviral therapy or delayed initiation, either when their CD4 count approached 350 or when they started to develop symptomatic disease. The study randomised approximately 2,300 patients into each of the two arms and had two endpoints. One was to look at whether early treatment delayed the onset of new AIDS-defining events, but also they took into account the issues around drug safety and whether early initiation of treatment resulted in an increase or decrease in new serious non-AIDS events. When we looked at the initiation of treatment, effectively everyone who started in the immediate treatment arm established an undetectable viral load very early into the study, whereas of course in the deferred treatment arm there was a delay in terms of the timing of initiation and treatment, and so gradually small numbers of individuals started on treatment and established undetectable. So there was always a big gap between the two groups in terms of who was undetectable and who wasn't undetectable between the two arms. In terms of CD4 count, again, going on to treatment, even in individuals who had a CD4 count above 500 at initiation, was associated with a further increase in CD4 cell count, whereas in the deferred treatment arm, as would be expected from the natural history of HIV, we saw a decline in their CD4 numbers over time. So the gap between the two over the course of the study was about 194 cells. So in terms of the primary endpoint of the study, there was a significant reduction in the risk of both new AIDS-defining events and serious non-AIDS events during the course of the study. That reduction in risk was around 60%, 57% reduction in risk by early treatment. So early treatment didn't entirely eradicate those events, but it certainly reduced the chances of those events occurring, even in people with very good health status at baseline. The majority of events that were observed in the study occurred in individuals with CD4 count above 500, underlining that these events do occur and are common enough in people within the study. When we look specifically at serious AIDS-defining events, here the reduction in risk was about 70%. And this was driven by two main events. In the African patients who participated in the study, there were more tuberculosis events in those who were untreated compared with those in the immediate treatment arm. In the developed world setting, it was predominantly about AIDS-defining malignancies, Kaposi sarcoma, non-Hodgkin's lymphoma, and for the purposes of this study, Hodgkin's lymphoma, which was also counted as an AIDS-defining event. So early treatment was preventing those events, but different events across the different settings where it was used. When we deal with serious non-AIDS defining events, there was a smaller gap between the two groups, but still a very important one. And the predominant difference here was in the early treatment group having fewer non-AIDS defining malignancies. So treatment didn't just prevent AIDS defining malignancies, but also non-AIDS defining malignancies. When they looked at other events, for example, cardiovascular events, looking to see whether there was a safety signal from medication in early treatment, there was no excess of cardiovascular events in the immediate treatment arm, and also hospitalizations and deaths were not substantially different between the two groups, and certainly there was no impact of treatment on increasing the risk. So overall, early treatment protected people against AIDS-defining and serious non-AIDS defining events. And this has led to a change in policy globally, where we really want to look at treating everyone with HIV to protect them, but also we know from studies such as HPTN 052 that we can also provide protection for their partners and loved ones by reducing transmission through early treatment. So the future for people with HIV is very much aim for early diagnosis and aim for early treatment with a group of medications that we have now, which are providing a high level of safety and efficacy and protecting people against serious non-AIDS defining events and serious AIDS events. Thank you.